Hi, welcome to Making It on Monday. It's a weekly workshop for mums and dads in the making. And today we are super excited because we're joined with Monique Cormack, who's an expert fertility nutritionist, who's going to talk to us all about what you can do to support your embryo transfer and nutrition surrounding embryo transfer. So welcome. So Making on Monday is brought to you by the Acupuncture Pregnancy Clinic, and we are an integrative traditional Chinese medicine clinic that really helps people with reproductive health, IVF support, and pregnancy care. And today we're talking all about nutrition around embryo transfer with Monique Cormack, who's an expert fertility nutritionist, because we know that the lead up to embryo transfer can be absolutely nerve-wracking time. And, you know, you've come so far through IVF treatment and you want nothing but just for the embryo to stick. So, and there's quite a few like old wives' tales. There's a lot of things that are kind of talked about quite a lot in terms of what is, you know, really what can help in terms of what you can eat. So today we're going to talk about, is that really legit, and like what things can actually help around embryo transfer in terms of nutrition. Are the things that you can do in terms of nutrition to help support that implantation process. And so for those of you who don't know, I'm your host today, and my name's Amy Forth. I'm an integrative traditional Chinese medicine practitioner who's been in practice since 2008. And these Making It on Monday sessions are all about mums and dads who are looking to try to conceive and start a family, and helping you by providing really relevant and also really research-based, evidence-based fertility guidance with like these weekly workshops where we bring you, you know, Chinese medicine fertility tips as well as nutrition. And we cover a whole lot, including bringing in the experts from both within and outside of the clinic. So these are just designed for you to help and support you through your fertility journey. So let us know if there's any topics that you'd like to talk about. But today we've got our special guest, who is Monique, and she is a qualified nutritionist who has a bachelor degree in both nutritional and dietetic medicine. She works with individuals and couples to optimize their fertility, pregnancy, and beyond, provides expert advice with a special interest using nutrition to help support IVF. Monique's passionate about helping others feel healthier, empowered, and supported throughout their fertility journey. If you want to get in contact with her or find out more, you can head to her website, which is moniquecormack.com, or you can find her on Instagram at Monique Cormack Nutrition. So for those of you joining us Making It on Monday, I just want to shout out that we're going to be streaming live Facebook, Instagram, and of course on our private Facebook page. And we encourage all of those people trying to conceive to join our private online community. It's an IVF and fertility Facebook group, and it's there to set up to help you, support you on your fertility journey. It's 100% private, and we have all our Making on Monday sessions in there, so you can head over to IVF, acupuncture, and fertility support. All right, but let's bring on, hi Monique.
Hi.
How are you?
I'm good. It's lovely to see you again. It's been a while. I guess no one probably knows who's on the live stream, but I've got a 6-month-old baby who is actually an acupuncture pregnancy clinic baby.
Yeah, that's true.
Yeah, I had acupuncture pretty much all through my pregnancy with Remy. So yeah, it's really lovely to be able to come on and do the live, because I feel so, I guess I just feel so connected to the clinic, and it's, you know, it was such an important part of my pregnancy, like my routine. And yeah, it's just really nice to be able to do something and give back to the group. So yeah, just happy to be here.
Great. Yeah, it's so great. Yeah, it's so great to have you here. And, you know, you were kind of like juggling a lot of things with a little 6-month-old to come today. So thanks.
Yeah.
Thanks for getting here.
You hear some screaming in the background. That is him. Because unfortunately he is not asleep. But yes, yeah, I'm really excited to be here and talk about something that I actually get asked about a lot, and I know that you probably get asked about a lot too, which is around embryo transfers.
Yeah, and particularly, I can't wait for you to talk about pineapple. So
yes, it's all about the pineapple.
And like, you know, in terms of like nutrition, what to do from a Chinese medicine point of view, I think we have like some pretty simple advice instead of dietary recommendations, keep warm, eat easy to digest food. But as a nutritionist, I'm like really keen to hear about like what are the kind of key essential nutrients and how do you get them and what do you do?
Yeah. And I mean, there's a lot to unpack. And so what I thought I would do, because I want to make this really practical for everyone who's watching, is I thought I would talk about, see how many I can fit in, 3 or 4 food-based strategies that you can implement yourself at home, right now that are not difficult, and explain the evidence behind them. But I also wanted to just make a little bit of time to do some myth busting, because I know there's some really common things that like pineapple, they get asked about all the time. So I thought I'd explain those so that you know why they're suggested and maybe why you don't need to do them. And I also wanted to say that actually a lot of the nutritional recommendations I'm making are perfectly be able to be integrated with a Chinese medicine approach. So the idea of having warm and easy to digest foods and keeping the womb warm is something that you can definitely integrate with actual nutritional medicine perspectives as well. Like it is possible to use the foods that I recommend and in the format of a traditional Chinese medicine approach. Like these things can all go together. We're not sort of, excluding anything.
It's often about the way you prepare it or cook it, that is
exactly.
The
And I do like the Chinese medicine approach in leading up to an embryo transfer during the 2-week wait, because I do think that even just psychologically, there is some value in warming the body and in nourishment and in taking things a bit more slowly and taking time to cook things and be relaxed about eating. And I think that is actually a very good therapeutic tool to use during a time when you're full of stress. And, cooking foods and having warmer foods might be a little bit easier also in your digestion when your stress levels and your anxiety levels are maybe peaking a little bit, especially after you've had the transfer and you're waiting to do that pregnancy test. I know that that's not always a really easy time. I think having an integrated approach is a really good idea. But anyway, on to the tips. So as I'm sure it will shock nobody, there isn't enough research into nutrition to support embryo transfers and implantation, because there's never enough research into anything. But we do have a couple of studies which have looked at specific nutritional factors for improving embryo transfers. So we do what we can and we use the best evidence available. So 3 key things that I thought I'd share today. First of all, is a really quick tip, a good one that came out of some research which looked at women going through IVF embryo transfers, and a study that looked at their dietary intake, their regular dietary intake, and what they had more of and what they had less of. And they divided up the groups into women who were more successful at having an embryo transfer in a clinical pregnancy, so actually going on to have a positive pregnancy test, and those who weren't. And something they noticed in the dietary pattern of the women who were successful was that they had a higher whole grain intake. Okay, so one thing that I do recommend to all my clients is if you're preparing for an embryo transfer is to increase your intake of whole grains. Now, whole grains are not a fancy, weird food. They are just readily accessible. We're talking things like oats and brown rice, quinoa, buckwheat, millet, whole grain bread, bulgur wheat. Like there are so many different types of whole grains out there. I guess some of the more simple ones are probably like whole grain bread, wholemeal pasta.
It's almost like old school healthy, isn't it? Like it's kind of like
old school
fancy, just like old school healthy. Like
and and it's actually also one of the foods that I think that a lot of people stop eating when they want to get pregnant, because they're worried about too many fattening carbs or bad for your blood sugar, or grains cause inflammation. And actually, the research suggests that having whole grains actually has an anti-inflammatory effect, and we definitely want to reduce inflammation leading up to an embryo transfer. So not only are they anti-inflammatory, but we have some research which shows that people who consumed whole grains were more likely to be successful with an embryo transfer. So, if you're worried about having toast in the morning, or you like porridge, or you like rice, you should actually probably have those things. And I actually suggest to have whole grains every day. Leading up to the transfer and after the transfer. And the reason I think it works is listen up if you have a thinner endometrial lining. We think that whole grains may actually help to thicken the lining of the uterus where the embryo is going to implant. So that's how we think they actually have that effect. So old school.
And can I just say, from a Chinese medicine point of view, those whole grains, they're really like qi nourishing, and they help with and they've got these kind of like blood nourishing properties because they really boost up your qi to help with how well you can absorb your food and, you know, and produce really good blood. So yeah, from a Chinese medicine point of view, when people are excluding whole grains, we're like, oh, we're a little bit, you know, it's not, it's a traditional, it's a part of a traditional diet in many cultures. So you're excluding massive food groups by excluding them.
Yeah, very much so. And I mean, I guess having a partly Asian background, like the idea of having a diet without grains in it, I mean, for me culturally also doesn't seem sort of normal as well. But I mean, we do have some science to suggest that this is actually nourishing. So have your whole grains. The second thing I wanted to talk about is actually to do with blood flow. And we can talk about the pineapple now. So something else that may improve implantation rates is increasing your dietary nitrate consumption. Now, you might have heard of nitrates to do with processed meats and bacon, and like they're a bad thing. And that is true. The nitrates in meat that are added to meats, like bacon and ham, we don't want. We want nitrates from vegetables. So in particular, nitrates from beetroot can be really helpful. Now, what these nitrates from vegetables do is they increase something in the body called nitric oxide, which sounds like something to do with cars, but it's actually to do with your body. And what nitric oxide does is it actually dilates your blood vessels and it improves blood flow around the body. So beetroot juice and concentrated beetroot juice is actually considered a sports supplement for improving blood flow and improving the flow of oxygenated blood around the body. Now, there was actually a study a few years ago in women preparing for an embryo transfer, and they drank a watermelon, beetroot, and ginger juice every day from the day of embryo transfer to the day of their pregnancy test. And they actually had an increased rate of a successful embryo transfer.
Yeah.
And we think it's because these dietary nitrates, which are really high in beetroot, improve oxygenated blood flow around the body. So having, I guess, this beetroot is a very rich, earthy kind of, I guess, a nourishing kind of root vegetable, and it's very high in nitrates, and we think it improves blood flow. So
that's so interesting from a Chinese medicine point of view. Like, if we're nourishing blood, we're looking at all the red foods, right? And so like the number one thing, we're kind of like, if you want more we always like eat beetroot, nourish blood, and all that. Think about all the red foods, they're going to be really important. So it's so interesting how they kind of like tie these kind of similar ideas together, but it's
a really similar. And I remember when I was my first pregnancy, I was in the UK and I was trying to get pregnant, and the acupuncturist I saw over there was actually recommending for me to eat more blood nourishing foods, and she gave me some beetroot recipes, and it was so funny. I had no idea, and actually that study hadn't even been published at the time. But now there is actually some evidence to suggest that this actually may help with embryo implantation. And yes, it is only one study, so I'm not saying that, having a juice with beetroot in it is going to be life-changing. But at the same time, I mean, if you're in a position where you're leading up to an embryo transfer, you want to do all that you can. And eating a vegetable is not a bad thing. So, to the extent that you can tolerate beetroot, I know some people I've recommended beetroot to have not been a fan, but incorporating it in juices, in dips, in salads, in casseroles, however you like it. I mean, I think it's really good roasted, and it's good in juices and things like that. To try and incorporate some beetroot. I mean, if you want to follow the study, they had it juiced every day from the day of embryo transfer to the day of pregnancy test. But that might get a bit tedious, so you can mix it up. Another thing that can increase dietary, increase nitric oxide in the body is also making sure you're getting enough magnesium. And I know, Amy, that you also encourage making sure you get adequate magnesium for stress relief and relaxation. So I would definitely also encourage getting enough magnesium. Magnesium is found in lots of plant foods like leafy greens, beans, nuts and seeds. So again, a lot of those really nice earthy kind of foods, really nourishing foods, like lots of root vegetables and things like that. That's another way we can increase magnesium in the body.
Great. It's nice when you can do it through diet as well, because I know also in times of stress people really burn through a lot of magnesium, and so while often I think they need a little bit of supplementation there, but they're really going through a lot of stress, but it's nice to be able to know what also is in your diet, where you can just kind of you can really help support it through what you're eating.
Yeah, and I think I agree. I do think, obviously this is a live stream, so I don't know everyone on the live stream, and I can't say whether or not, it's definitely safe and right for you to supplement magnesium. A lot of people do benefit from magnesium supplementation, particularly in the lead up to a transfer, because it's obviously a time of increased stress, as is all fertility treatments. So supplementary magnesium might be something to discuss one-on-one with your practitioner, and then also increasing your plant foods like beans, nuts and seeds and vegetables to try and get your dietary magnesium up as well. And then while we're talking about increasing blood flow and things like that, I thought I might deal with the pineapple issue because everyone is having pineapple. Now, the idea of the pineapple is actually related to blood flow as well. So the reason pineapple gets recommended is because pineapple contains an enzyme called bromelain. And this enzyme, it's actually a protein digesting enzyme. So if you apply this enzyme to a piece of meat, it would tenderize the meat. Okay? It breaks down protein. And the way this enzyme works is theoretically, just like I said, there's no scientific study to back this up. Theoretically, this enzyme would thin the blood, and improve and reduce inflammation, and have this sort of thinning effect where the blood would flow more easily to the uterus, okay, and then support implantation. Now, this enzyme is most concentrated in the core of the pineapple, which is where you get this pineapple core eating recommendation.
And this has been around for such a long time. I think for the last 15 years since I've been practicing, I, probably get someone ask me weekly about pineapple core and whether they should eat it, if that's really a thing. And I'm glad that you've just explained it. Well, I knew there was some components, but I was like, I don't think there's any research around it.
There's no research.
I don't think it's going to do any harm either. So it's really
I mean, if you want to, if you want to eat it,
do it.
If you want to eat it, by all means, go for it. But it's probably not going to be, what you could do, I guess. Is you could juice. So beetroot, you could juice beetroot and pineapple together if you really wanted to have the pineapple, because it would make the juice sweeter.
Ginger to keep your digestion.
Yes, and some ginger. So beetroot, pineapple, and ginger. You could do something like that. You could have the pineapple. I appreciate that mentally you may feel better if you eat it because you have heard it so many times, but you also really don't need to have pineapple. I think you'd be better off having whole grains and root vegetables like beetroot, which actually have more evidence behind them than having pineapple. So that's why that's what I would focus on.
Sure.
And then I guess the one other thing I wanted to share, like a quick thing that you can do, is there's a lot of research, emerging research coming out about how our microbiome, so the bugs that live inside us, might affect embryo implantation. Now, everyone probably thinks of the bugs in our gut, having gut health, because that is also a very trendy topic. But you actually also have bugs that live in your uterus and your vagina, which is not super yummy to think about, but you actually do have little bacterial microbiome colonies living in your uterus and your vagina. And there is some evidence now to suggest that when these are out of balance, that embryo implantation rates are reduced. So we've found some associations between having abnormal vaginal microbiomes and reduced rates of embryos being transferred and implanting. Now, things that you can do to support your microbiome are, one, to eat lots of fiber, so lots of plant foods, and whole grains, what we've been talking about already.
Great.
And then to focus on probiotics. So your probiotic-rich foods are your fermented foods. And you can also consider a probiotic supplement. I can't make an individual recommendation, obviously, on live stream, but you're looking at lactobacilli. That's the species of bacteria that are in the vagina. Having a lactobacilli dominant microbiome is what we're really aiming for. So
can I just say, I was at a presentation about this. Would have been 4 years ago, I think now, at the last Fertility Society of Australia annual conference, and they had someone who came over from Germany who presented about the microbiome, and it was incredible. And it really, it made me making sure that everyone's microbiome, is covered off, I think is really, really important, because the evidence is quite compelling, I think, in terms of how it impacts embryo transfer and implantation and things like that. So yeah, definitely a great one to include in. I'm really glad that you mentioned that one. Yeah.
Yeah. I just think I'm in my clinic. I'm looking into it a little bit more, and I find myself more and more frequently ordering. It's actually possible now to do vaginal microbiome testing and things like that. So for people with recurrent implantation issues, or even just people who want to know, I'm finding that I'm looking into that more and more. Because again, you just want to optimize everything. Do you know what I mean? Like you want to you want to look at every factor, because I know how incredibly important every embryo is. So
yeah, absolutely. And there's people who who have had an obvious history where they've had a lot of antibiotics use or so on and so forth. There's things where it really kind of flags that potentially that they're the good and the bad bugs might not be in like a really good balance because of their history. So it's a great one to look into. So thank you for flagging that to our listeners.
No, it's a pleasure. So those are the sort of, I guess, the three main things I wanted to mention today, which I think are all things that you can incorporate straight away, which is one, to have more whole grains, have them daily, increase your intake of things that improve blood flow, so in particular beetroot. You can also increase your magnesium intake, discuss a supplement with your practitioner, and then focus on your microbiome. So lots of probiotics. And again, if you're looking into a supplement, again, discuss that with whoever you're seeing to make sure it's safe for you to take, but also work on your probiotic foods as well.
Yeah. Great recommendations. Thank you so much for joining us today. And I'm sure there's going to be a little bit of talk and questions, but in the comments. But yeah, thanks so much for spending some time with us today on Monday and making it on Monday. And like, I think it's a great topic, because so many people in the lead up to embryo transfer, and also that in that 2-week wait, you just really want to do everything you can to
absolutely
help. And so it's great to just have some like really kind of practical and actually not too difficult tips, out there.
They're not difficult.
You can do your diet and nutrition. Yeah.
All right.
Thank you very much. Thank you very much for your time. And we look forward to, seeing you again sometime soon. And there is, if you want to get in touch with Monique, you can go to, at Monique Cormack Nutrition is the handle at in Instagram. Yep.
That's right. All right. And I've got plenty of extra resources on supporting implantation if you need them. So just get in touch if you do.
Oh, fantastic. Oh, thanks so much for your time. That is excellent. All right. Well, thanks so much. See you, everyone. Bye.
All right. Bye. Thanks. Bye.